Good morning. During our St. Louis County stay-at-home order, voluntary compliance was important, and it's an important part of our success. We depended on our community's common sense to follow our direction, follow the direction of the public health officials and our health systems, and that's why we're in the position we're in today. We've made a lot of great progress as a community. We have done well compared to other parts of the country and other parts of the world. We have still had tragic number of hospitalizations, a tragic number of people sick with COVID-19, and a tragic number of deaths. But we are better positioned to come out of this because of the early decisions we've made and because of our community's commitment to stopping the spread of COVID-19 in our community. In order to ease our safety restrictions in our community, we need to see the data. The hospitalizations need to be coming down, the hospital admissions need to be coming down, and the ICU admissions need to be coming down. In addition, we need to have a robust testing environment. We need to be able to test everyone who's asymptomatic, and in congregated living centers, nursing homes, and other high-risk areas, we also need to be able to test everyone who is high risk of exposure or who is asymptomatic. Other parts of the state of Missouri have a different setting, a different situation than we do here in St. Louis County and in the St. Louis region, and that's why we're moving at a different pace. We understand that the governor's stay-at-home order will be partially lifted with restrictions today. St. Louis County is not ready to do that yet, but we're watching very closely. We'll continue to watch the data, and we'll watch and wait and see what the response was to the county's bid process and request for people to sell us more testing supplies. And that bid process will close at 5 o'clock tonight. That's an important variable in our determination of how we move forward. We've always had a target of mid-May. I spoke to Mayor Kruzan this morning and last week. We both have a target of mid-May, but neither one of us are prepared to settle on any specific date yet. Our decision will be data-driven, and we'll be watching very closely Dr. Garza's report this afternoon of how the hospitals have done over the weekend. Moving forward, we still have to maintain the things that have put us in the position to be successful and start to ease and continue to have this conversation about easing some of our safety orders. That means social distancing, stay 6 feet away from others, avoid large crowds, wear a mask when you're out in public, especially in areas where social distancing is going to be difficult. And I'd be glad to answer questions. Go ahead.
Dr. B, you alluded to it there, and you alluded to it last week, but I'm just wondering, is there something specific about the St. Louis County situation that makes this a longer process than the rest of the state of Missouri? Is it just the number of cases? What in your mind is the key holding back here?
Well, certainly the number of cases. We have 65% of the cases in the state of Missouri are here in St. Louis County. We still have a significant number of our tests that are positive. We still have a significant prevalence of the virus in our community. We understand that our social distancing and stay-at-home orders have suppressed the viral activity, but we're not where we need to be yet. We do believe that we are trending in the right direction. We've watched the reports last week. It appears that we've reached the peak. We need to see this trending down, and we need to see it continuing to trend down, and we need to have an adequate and robust testing environment. It's clear that St. Louis County has been hit harder than the rest of the state. The governor recognizes that the metropolitan regions have been harder than the rest of the state, and all metropolitan regions in our country have been hit harder than the rest of the country. And if you look at how social distancing orders have been held in place, how they've been weakened or eased in other parts of the country, we still have more challenges in our metropolitan regions. But we do believe that the trend is in the right direction. We do believe that this week is the time to have the conversation of what that might look like. and we will give our businesses guidance on social distancing. We intend for that guidance to be very similar in the city of St. Louis and in St. Louis County, and our staff are working together with our business leaders, with our public health leaders, to determine what that guidance would look like. And we hope to be able to share that guidance when we're ready to make a decision about what the proper date will be, what the right date would be, and that will be a data-driven decision based on what we see in our hospital systems and advice from our public health experts.
How concerned are you with these other surrounding counties partially reopening today, St. Charles County, Jefferson, Franklin? Is there a concern there about perhaps cases here upticking from more people being out and about there and traveling around? What's your thought on the reopenings around us but not here?
Well, you saw over the weekend that at the federal level, the White House has revised their estimates of the impact of COVID-19 on our country and the loss of life that could be associated with this virus. And they've revised that based on by the weakening of social distancing restrictions in our country. We know that when we ease our restrictions, that the virus will spread in our community. It has to spread at a rate that is controlled, and we have to be able to provide medical care for the people that are infected. We have to identify them quickly. We have to get them the advice that they need, medical treatment if they need it, and we have to find the folks that they have become in contact with. That's why contact tracing is so important. We need testing, isolation, and contact tracing. And St. Louis County is in the process of hiring another 100 people to manage the contact tracing piece, and we expect that we'll be hiring more over the rest of the year, and we'll maintain that workforce into 2021 because that will be an important part of the recovery. So we know that the virus will spread in our community when we ease our social distancing restrictions, but we also know that at some point we have to do that. We have to do that when it's safe and when it's responsible and when it's thoughtful. That means the curve has to be coming down. Our hospitals have to have the capacity to manage our patients who are sick. We have to have protective equipment in our hospitals. We have to have a good testing environment, and we have to have the ability to advise people who test positive and find people who have come in contact with them and advise them as well.
With those counties reopening, then, could that set back our reopening if the infections start crossing county lines into St. Louis County?
No, I believe that St. Louis County can make a decision on reopening based on St. Louis County data. That what's happening in the region around us will impact us some, but the biggest impact will be our decision will be made mostly on what's happening right here in St. Louis County and St. Louis City.
Last week you said that you thought maybe late this week you could have a specific timeline. Is
Yes.
that still kind of?
Yes, I spoke to Mayor Cruzen this morning and last week, and our goal is to have a timeline by midweek with guidance for businesses as well. But it's too early today to pick a date and start building around that date. We really need to see the reports from Dr. Garza over the weekend and make sure that we're continuing to trend in the right direction.
Timeline by midweek for reopen.
Timeline for a decision to reopen by midweek.
Okay.
Yes.
So that would include a date, I'm assuming, to
Yes,
reopen?
it would include a date and a plan.
Okay.
Yes.
Okay,
But
so
that needs to be made together with the public health officials, with our health systems, and with the city of St. Louis.
I'm sorry, we have a question from Channel 5. It's similar to what Chris had said. With Missouri starting its reopening plan today and neighboring counties like St. Charles County starting to reopen businesses, what message do you have to St. Louis County residents who may be tempted to go to other counties that are open and then come back to their homes in St. Louis County?
Well, I think we have to recognize that St. Louis County is still greatly impacted, and that our reopening strategy and our reopening timeline depends on our residents complying with the social distancing orders. And we understand that this is frustrating, and we understand that other jurisdictions will have different timelines. But it's very important that the people who live and work and are in St. Louis County, that they respect the social distancing guidelines that are in place here. That's what helps control the spread of the virus. That's what's helped get us where we are today, and that's what will help keep us on the timeline. Our success moving forward in the next year will depend on decisions that individuals make. We can't depend on someone else to make the right decision about social distancing. This is a decision that we all own. And if we do this together, if we stay on the timeline that works for St. Louis City and St. Louis County, then we'll move forward together.
Sam, I understand there's no specifics yet, but are you still thinking mid-May is a good?
Yeah, mid-May's always been our target. It was our target with the hopes that our social distancing measures will continue to take us in the right direction. We've been fortunate here in St. Louis County that we've had good compliance with social distancing measures. It's been tough for a lot of people. It's been tough for a lot of businesses, but it's gotten us to where we are today, and it's allowed us to fare better than the rest of the country, even though we were hit much harder than the rest of the state, like any other metropolitan region would be. So we just need to stay on this timeline.